let's start with our panelists over here, and then we will let our online panelists introduce themselves. Dr. Schumann, would you like to start? Tell us a little bit about you, and thank you for coming.
Always have to stand up when we talk. So sorry, you might not necessarily want to, but anyway, thank you for having me. My name is Abby Shimon. My last name rhymes with lemon, in case you're ever trying to repronounce that sometime. I'm a pharmacist. I've been a pharmacist for 20 years, and I went to Drake University in Des Moines, Iowa. I have quite a bit of experience in multitude of different fields of pharmacy. I worked retail just for a little bit, and then I went to go work for CVS Health or Caremark for about 16 years. I worked in the prior auth department. I was a clinical advisor. I worked in the specialty department. You name it, I pretty much did it and did quite a bit of it. And then after that, I went to Healthcare Service Corporation, which you guys will probably know a little bit more commonly as the Blue Cross Shield of Texas. So we had 5 different states there. I worked on a multitude of different things, including RFPs, which stands for Request for Proposal. I worked on self-funded clients, which are clients that actually make their own decisions on the insurance. And I helped develop different drug lists and formularies. And most recently, I have transferred over to work for pharma, and I worked in market access and public affairs. I'm also the president of the Southwest affiliate of the Academy of Managed Care Pharmacy over Texas, Oklahoma, New Mexico, Arkansas, Louisiana, and Arizona.
That's great states.
Thank you.
Thank you, Dr. Rafia Rasi, and thanks, Dr. Shah, for inviting me to participate in this introduction to the program AIML in this course, right? The outcome research. My name is Netra Sambamurthy. I'm a statistician by training. I'm an entrepreneur. I promote an institute called Institute of Analytics, USA. It's a global institute. And I also have a consulting company called CRM Portals, Clinical Relationship Management Portals. And I teach at Northwestern University AIML program. I'm also not training here. I will be teaching the courses 5227 and 5228, which are supervised, unsupervised algorithms. So for AIML, I'll be meeting you, if you're coming into this program. I'm very excited about working with healthcare people, the huge opportunity that healthcare offers with AIML. So you will get to hear some of those things during the presentation as well as the question and answer session. Thank you.
Thank you, Dr. Netra Sambamurthy. It is an honor to have you here with us.
As you heard, everyone, I just want to interject that he's the one who is teaching machine learning courses in our MSAOR, which is Masters in Applied Outcomes Research Program, all online. And he is a specialist, not only in United States, internationally. So thank you for joining.
My name is Usha Samamurthy. I'm a professor in pharmacotherapy department in College of Pharmacy. Actually, I was introduced to AIML because of my grad students. My grad students came to me and said, Dr. Usha, the field is changing. How about expanding into the artificial intelligence and machine learning world? So I think I started in this AIML space about, I would say 2013, I would say. And I come from a world of statistical learning. You all know, right? Chi-square statistics, is there a relationship? Is there an association? For me, everything was, I had to learn it all by myself because at that point in time, there were not courses that were offered in a program or I couldn't take a certificate or anything like that. So I learned from the Institute for Health Analytics USA as well. And then I learned on my own, watching a lot of videos and learning Python from the Institute as well. So um, as I got more and more into it, I began to appreciate what it can do for health outcomes. So I am one of the faculty in the Applied Health Outcomes Research Program, certificate program, as well as the Master's of Science in Applied Outcomes Research. I teach patient prep. I'm like kind of a generalist, so you will see me all over the place. Okay, and welcome. We are very delighted that you are here, and I hope you will get something out of this introductory course. And please also share it with your friends if you have the interest or curiosity. All we ask of you is just bring your curiosity, nothing else. Thank you.
Thank you, Dr. Usha Sambamurthy. You are the brain and mind and architecture behind all of this program that we are creating and our master's in outcomes research or certificate in applied health outcomes research. So thank you. With that, I will let our panelists who are joining online, Dr. Suman Niranjan, would you like to go next? Thank you.
Yeah. Hi, good afternoon, everybody. My name is Suman Niranjan. As Rafia mentioned, I would like to first thank Rafia to give this opportunity to be part of this health outcome panel. Really excited to be here and then talking to you all about what I know. And I probably am a little odd out in the panel, coming from a far distant discipline, I guess. As you can possibly see that I'm an assistant professor for logistics and supply chain in UNT Denton. And my connection with AI ML starts, I mean, even though we term or coin it as AI ML, it has always been predictive models or predictive modeling. And my background has been in applied math and applied stats. So I'm an engineer by trade. I have a PhD in industrial engineering. Working in stats and working in applied math is something that we've been trained in. Even though the word AI and ML has taken over all of that, the formal training has been in multivariate statistics. And that's how the interest came in. And I was also a visiting fellow in 2014 to UNT HSC through a particular program that was run in Health Science Center, where I used to come once every month to Fort Worth. I was not there at UNT then. I was at Savannah State University back then. And then I was trained on health disparities and also on how to write proposals and grants for NSF and NIH. And that's how it all started. And then I ended up coming here, joining UNT in 2019, which is when I got introduced to all the other folks, and not just folks that I used to work formally in biomedical sciences, but also in pharmacy as well. In the past 2-3 years, been working on several projects. Fortunately, luckily, ended up getting one of the pilot projects that got funded this past year, which is already funded through NIH, the AIM Ahead project, which I believe Professor Usha Sambamurthy is part of it, and like to thank her and then also the PIs of the grant to provide me that opportunity. So for people like us who are from non-health sciences background, it is a great opportunity for us to learn firsthand about the data and then all the other things. But that's where my AI/ML background comes into the health science application. I'd like to converse more as we move along through the panel. Thank you.
Thank you, Dr. Suman Niranjan. And I would also like to mention that we are collaborating with him. He's a computer scientist and now interested in health outcomes. So our collaboration regarding machine learning and artificial intelligence is through that project he's talking about. So you see that this is a field so multidisciplinary, different skill set needed to apply. Thank you. Dr. Chen, I know we are collaborating with you, so please introduce yourself and our collaboration. Then we will start taking questions and hear from others too. Thank you.
Great. I'm Chan. I am an associate professor and division chief of outcomes research and quality at Penn State College of Medicine. My background is in health economics and statistics. It all started from me seeking out Usha as my mentor. She has been just an amazing mentor, and many of her students and mentees would attest to that, I'm sure. And since from the start, when I started working with Usha, we worked on huge databases with health information and healthcare claims and registry data. And so we find it really very natural to get into the artificial intelligence and machine learning. Indeed, a lot of our research before was already dealing with big data. Yes, and it has been like more than 15 years we've been working large healthcare databases. And this new direction of machine learning has been a great experience. And I feel very lucky to be part of this project collaboration with everybody. Very excited about the multidisciplinary approach that we're taking. I get to know people from various different fields on our team and working with them. I feel that I can always learn something from each member on the team. And I feel very fortunate to be on this team.
Thank you. Thank you, Dr. Chen. With that, let's hear from our MSO learners. Would you like to briefly talk about a little bit about yourself? I'll start with those who are in person. Chris, you go first, and then Arden, and then if we can, we will hear from Walter and Patrick. I think you both are here. Thank you.
So hi, my name is Chris Ingram. I'm a dual degree student here at UNT HSC. I'm pursuing a doctor of, I thought they made me. Hi, can you hear me? Okay. So hi, my name is Chris Ingram. I'm a dual degree student here at UNT HSC. I'm pursuing a doctor of pharmacy degree as well as master's in applied outcomes research. And just a little bit about me, what really got me interested in this field is just like whenever I was looking on the website doing my research about the master program, I saw that I was really interested in the machine learning, kind of combining technology and healthcare, and that with my background and my family and everything, that would really interest me. And also, like, it's take another step where aspect to help making clinical decisions, formulary decisions, just a better overall analysis of data and everything. So that's why I'm here in the program, and hopefully I'll be successful.
Thank you.
Hello, my name is Arden Powell. Similar to Chris, I'm a dual degree with both the MSAOR program as well as pursuing a degree in pharmacy. So for myself, what attracted me to this whole program was learning more about how can we use data in our future profession to see, how patients to improve their health outcomes, whether that's through analysis of data or being able to provide decision making through the results received. So that's a little bit about me.
Thank you, Patrick or Walter.
Hi, everyone. Patrick Bithua here. I am not an outlier per se. I'm a veterinarian by training, and I hold a PhD in population medicine and epidemiology. I came to this program because I wanted to learn some robust methodology in using big data to answer research questions. And I must say I'm not disappointed so far. It's been well put up. I'm learning a lot of new things, and I can't wait for the machine learning modules that is coming in the summertime to be able to leverage that kind of skills to do the kind of stuff I want to do with data.
Thank you so much.
Walter, I don't know if you can speak. I cannot control several things from here. Thank you for joining. I will speak a little bit about Mr. Walter Agbarbawa. He's a PharmD working full-time, so making time to do this master's program with us because he also knows and make our data talk through different level. So thank you for joining and your interest in the program. With that, I would like to start with very simple question. Any one of you can chime in and use your microphone, whether you are online or here. So let's start. How would you explain AI ML, which is artificial intelligence or machine learning, for someone who is not used to with this term?
Pull up a slide from here, which would be much easier.
I'll share your slide. Want to use your microphone, then I'll turn it off.
So before I even start, I just want to give you people often have this confusion. What is health outcomes, right? Whenever I say health outcomes, they're always thinking about survival. That's all they're thinking about. Okay. Health outcome means either survival or hospitalizations and something like that, right? But I think, you will appreciate it along with what is AIML is to know just one simple definition of health outcomes, which is basically on the green circle, umbrella term that examines all facets of health and well-being of patients and populations. So the health outcomes is basically examining all facets of health. So let's say that you are interested as a pharmacist in improving somebody's medication adherence. That medication adherence is an outcome, right? So you have to think about it, any kind of end result that you want, regardless of whatever it is. You may want someone to be connected to health resources, like they may not have insurance, right? As a pharmacist, you often hear this, right? And you may connect to a person who may facilitate that, getting the coverage. That is an outcome for you. So think very broadly when you think about health outcome. So when you think that broadly, that what is AIML will make sense.
So the question is, what is AIML, right? I want to bring this news today. Today's news, actually, yesterday I posted it in my LinkedIn profile. I'm very active in LinkedIn. 40% of the companies, they claim they are doing AI ML, but actually they are doing simple statistics. It has both positive and negative impact in the definition that I'm going to tell you. It is more than statistics. I am a statistician, so I can say that very freely. It is more than statistics. I moved to AML because the world is changing towards more and more and more and more and more data, not only captured because we are observing, but also the machines are creating lots and lots of data. They are more like usual data is rows and columns. I hope you understand what I'm saying. Usual data is always rows and columns, but that's not the case in real life. Your images are different type of data, and your videos are different type of data. Text is a different type of data. So all these things are getting accumulated faster and faster and faster. The question is, how do we get benefit out of it? And that's where the automation comes into play. So AI without automation doesn't exist. So today I'm going to tell you what is AI, which will be a very important learning, I believe. At least one thing that you can take it from my side Is this what is meant by AI/ML? So the point is the data are coming faster and faster. We have to process all those things. So there are 4 technologies. That is data, as it's technology. Okay, right now, it's not just observation that we observe. And then analytics, that is also a technology. Algorithm, broadly called algorithms. The third one is technology per se. Okay, technology per se, by which you interact with the real world, with other people, environment, and the biome. Okay, so that is the third component. Finally, automation. So a system that does not include any one of these cannot be an AI. That's not the only difference. I'm going to give you a lot more the effects of such a configuration. So interestingly, you see that one: B, data; A, analytics; T, technology; A, automation. If you take the first letters of each of these, what do you get? No, if you take the first letters of each of these 4 words, what do you get? Data, right? So you'll remember that. Now, AI/ML is a solution. Now you can see the effects of AI/ML. Why it is totally different from the past world. Okay? It is 724. It doesn't rest. Point. Second one is behaves like an intelligent advisor, highly personalized. That's not the case in the earlier statistical world. I mean, I have to make some comparison here. I have no bad feelings about statistics. It has its own place, but it is beyond that. That's what I'm trying to impress on you. It behaves like an intelligent advisor, providing the services, interactive services, 724, and it treats everybody equally, irrespective of the language, religion, region, and gender, and whatnot. Isn't it such a wonderful world? So that's power and beauty of AI/ML, which is not what you get usually in the usual computational methods, because humans are a lot more involved. But they will also tell you a negative thing. If something happens wrong in the AI/ML, it affects everybody in no time. In no time. So that's the third one. Fourth one is it is automated, credible, and the behavioral needs of humans are taken into consideration, and it uses all the data. So I'll start with this. We have characteristics on AI/ML. That should define what is meant by an AI/ML to you. So if somebody comes and tells you, I'm doing AI/ML, you have to question, does it involve this? You don't have to question the other person, at least internally you can verify whether it's an AI/ML or not. But it is at the end of the spectrum. There must be some work you have to do in between. It takes a long time to come to that level. That's the ultimate solution development area. Okay, so I'll stop here. I hope this provided you some clarity on what is an AI/ML.
We're getting some comments from those who are joining us.
If we could try maybe without the microphone.
Then speak louder.
Okay.
Speak louder.
Thank you.
Got it. All right. Before we go to the panelists on these online, I just put up this, slide, which is a very simple definition, right? You see artificial intelligence mimicking human decisions making at scale using all input data, touch, smell, sense, speak, and communicate, right? So are we there yet? Not yet. It'll take some years to go to that far right corner, right? And then you have the middle part, which is the statistical learning, machine learning. This is everywhere now. How many of you have taken Uber? See? How many of you are on Facebook, Instagram, Amazon, Netflix, Prime? There, right? AI is everywhere. If you have used any of these technologies, you have touched AI. Right? Amazon, when you order something, it will give you, I know it's like for their profit, I agree. but it will give you like, other people have ordered along with this set. Do you want that, right? And then you get like interested, right? And then Netflix, it will say, hey, you have seen this movie before, and then, we are giving you recommendations, right? They are all part of that middle part, right? They are all like, learning. The machine is learning and giving you input. The machine is learning. And as Dr. Samurthy said, they're advisory capacity right now, right? And it's there right now, everywhere it is there. So you would see like FDA, November 2022 alone approved. You want to take a guess? How many AI tools? Any guess? November 2022 alone, how many you think? Take a guess. Two. Higher. Let's go prices right. Higher. Higher. 100. Higher. 1,000 lower. Okay. 522 AI tools were approved by Food and Drug Administration in November 2022 alone. So as Dr. Samurthy said, you can see the explosion, right? So that middle part is right there. And then you have the next generation deep learning, right? Deep learning is, as Dr. Samurthy said, you cannot do statistical learning with images. No, you cannot. You have to have a machine learning. So that is the deep learning. It analyzes text, audio, images, video, and they are like not like, simple, like, 2 or 3 or 10 or 15, right? Observations or something like that. These are humongous amount of data. And then, the deep learning is the next generation machine learning, they call it, right? So it's basically mimics your neural network and the brain networks and all of that, right? So this is kind of what is AI/ML. And I want to ask the panelists online, do you want to add anything to this? Dan or Suman?
Really quick, just from the question that Rafia asked earlier, AI/ML for people who may not be knowing what AI/ML is, just in very plain sentence, I would say that past historical data is fed into a computer, and the computer makes decisions on behalf of that data that is being entered. And it intelligently makes decisions, not just based on the actual data, but it learns from the data, and then it actually gives you the decisions. Now, the data can be anything. In this context, it is healthcare data.
Thank you. And you want to add anything? And our panelists from here, you want to add anything?
I was just going to say, I'm more simple, I think, with all of this.
Mostly like application.
Yeah,
Where
more,
are you going to-
I think it's more of the application, but I think it's like he was just saying, it's the computers are starting to understand the relationships between everything, and they're able to go out and help us make more informed decisions. And so I think you were talking about your acronym data. I mean, that's truly what it all comes down to, and finding out commonalities and how it can be used. And then at some point, you don't need the human component as much anymore.
Thank you. And I saw a comment from Walter Akbarbawa. He's a pharmacist. So he's saying that now AI/ML is used in dose optimization. So you see your role, those who are pharmacists. If you are not a pharmacist, you see we cannot do anything without this knowledge to do or apply AI or machine learning. With that, I want to talk a little bit about equity and disparity. I know, Dr. Sambamurthy, this has been your research and talking point, and we talk about it here at Health Science Center in many different colleges, schools, application, research. So I would like to get everybody's point, especially from our panelists. What is equity and disparity, and how and where AI/ML or health outcomes research that we are talking about will better health outcomes?
Okay, yeah, so again, I just want to give you some visual
Come back to this slide.
Yeah. And then so again, I am all for simple definitions, right? So I'm going to give you a very simple definition, and that's also going to go on the screen. Very simple definition of health equity is all human beings have to have the opportunity to achieve their best health, what they perceive to be their best health, right? Very simple definition. All human beings should have the opportunity to attain their best health. It's not what I am saying their best health. It's just what they perceive to be their best health, right? So, and then health disparity, again, a very simple definition. It's differences between two groups. Like immediately people will ask, like, I know that my granddad is very sick, and there is naturally as you age, right, there is going to be a difference between younger people and older people, because older people are like, will have a higher rates of mortality, and not so. Forget about the auto accidents and all of that leading cause of death among the youth, but just in the normal course of life, right? That is not disparity. So for something to be called a health disparity, it has to be tied to either a social disadvantage or an economic disadvantage or some kind of a disadvantage. So for example, so people often say health disparity, immediately they will say non-Hispanic white, non-Hispanic black, Hispanic differences. That's not it, right? It's not just that alone. It's like if you have a difference in rural and urban areas, this is actually a slide from CDC. We have lots of technical glitches today. So here is the CDC from 1999 through 2019. This is just age-adjusted death rates, right? In health outcomes, we call this a hard outcome. This is in the outcome hierarchy, this is the one you want to avoid. So if you go and ask my doctor, I often ask him, like, what is that you are interested in your patients, like in terms of outcomes? He will say 3 things. Number 1, I don't want them to die, right? That's his outcome. I don't want them to go to the hospital. That's his second one. He always says that. And the third one is, I don't want them to be like visiting the emergency room all the time. So these are his priorities. So whenever my doctor gives care to his patients, he always tells me that these are my priorities, right? So this is the supreme outcome of everything. And this is the age adjusted. Remember, I said older people and younger people, there will be a difference. This is age adjusted. And you can see this is rural urban. I'm not talking about race, sex, mental health or anything like that. It's rural urban. This is a disparity. And you can also see it started like, you can see the distance. Now you can see it's even widening, right? So this is where I think, we need all the tools that we can get so that we can make this thing go away, this disparity to go away, right? So in terms of better health outcomes, that is how it is tied to health disparity. So you want this outcome, right? The age adjusted death rates, the difference between rural and urban areas to go away. So that's kind of your health disparity and health equity. Is there another question? Or?
There are several.
Okay.
I want to ask this anybody, but maybe Abby, you can chime in first. Connecting with what you know and where and how a managed care pharmacist or anybody or any healthcare provider can utilize AI/ML.
So one of these areas that we most definitely did it when I worked at Blue Cross Blue Shield of Texas. You're gonna hear the term predictive analytics, but that's also like kind of it's a little different, but still it goes into machine learning quite a bit. And so as far as it goes, one of our biggest things that we had was a program called Rio, which was an integrated area where that we had pharmacists actually working in it, looking at different claims data that would feed into a system. We had our behavioral health care nurses, our caseworkers, et cetera. And so it's all, again, all of this data that was being fed into one area, and then eventually looking at to see from other claims that may have happened from different patients that we had, like diagnoses codes, et cetera, all again, this huge big old cloud of data. Who are the people that may be likely to have a relapse or need outreach or something like that? So that's one specific area where, as a managed care pharmacist, we were able to go ahead and have many different types of intervention to go ahead and reach out, whereas the computer helped us do that and all the machine learning, whereas we individually absolutely would not have been able to do that on our own. So that's one way.
Thank you. So these skill set are utilized in real world and to make the right decision, as panelists are talking about.
Yeah, they allow us definitely to help a larger population of people, and it helps us to look, I think it's also, we have to look at the whole population. And then when we look at, we have to look at the underserved population, we have to look at the Medicaid population, the Medicare population, the people with private insurance, people who don't have insurance. And it's so all of those different kinds of components that we can pull in actually will help us have the best outcomes in the long run.
These type of skill sets are utilized in those who are working in industry or consulting organization, or like a medical liaison persons, if they can find out a way to utilize this model, and also knowing this skill set will help them to even do better.
Yes. Yeah.
Thank you. Dr. Netra Sambamurthy, would you like to add anything?
I asked a specific question about care management.
Mhm.
It's applicable all over in healthcare. We are just getting in, area at a time. Perhaps it takes a long time to, penetrate into healthcare because a different setup. Privacies are huge. Every individual matters. All those things. So we are moving into the direction of more and more applicants coming out of it. Definitely the core concept, I pick up from her answer is that personalization. Very, very important. And that's where AI/ML is super. And it really addresses the needs of the society because people are different. For various reasons, including what Dr. Usha was saying about the disparity issues. How do we address them at an individual level? This is where AI/ML excels. And it excels very, the entire population. That's another beauty of it. And it doesn't discriminate. There's a very sensitive statement I'm making here. I made that earlier also. If done well, that is the issue. And that's where we all need to be trained and we need to be part of the solution development. If we do the AI/ML very, right and well, this is going to be one of the best equalizer, in terms of providing services to individuals, irrespective of how they differ. But if you made the mistake, it's superpower, it has such a superpower. If you made a mistake, it's going to affect everybody instantaneously in a wrong way. So that's another reasons why all of us need to be trained in a proper way and use them, develop them and use them for the benefit of the people.
Dr. Sambamurthy, would you like to add anything to this or?
So
anything?
I was just like the equalizer part of it and then the drug dosing, right?
Sure.
So I just wanted to say that, the digital twins are very, very, emerging technology right now. So what happens in a digital twin is you can experiment with the digital twin, in real time. So you make a replica of exactly a replica of me. And if you want different drug dosing, you can do on that digital twin to figure out, what effect it has. So a company in Switzerland actually is using digital twin, right, to do the dosing and so.
I just want to let students know it's like a few minutes to 1 if they have class.
So this is the one that, I want to share, like, the AAML doesn't know what health equity is. It doesn't know what a health disparity is, right? Whatever you feed into the machine, that's what is going to come, right? So as you said, if done well, Medicaid population, Medicare population, right? Other kinds of underrepresented communities. So you need to have the data, data. Remember DATA was the essence of artificial intelligence. You need to have good quality data. For example, they found that in 2020, it's a JAMA article, there are 50 states, right? Only 3 states contributed data to deep learning, right? Only 3 states, California, Massachusetts, New York, right? The rest 47 states, 34 states did not have a single person contribute data to deep learning algorithms, which means we are missing out, right? We right now don't have deep learning algorithms that are representative of local populations, right? So that is a big challenge. As you said, you asked me about, AAML and better health outcomes. It will better health outcomes, yield better health outcomes only if we all feed right things into it, right? It doesn't know what's an equity, what's an equality and all of that, as this slide represents here, right? You give cycles to everyone, regardless of whether it is a child or somebody is on a wheelchair, it doesn't matter, right? But then for equity to be achieved, you just give the personalization. And again, AAML is going towards that personalization. How do we make sure that each person achieve the best outcomes through personalization?
Thank you so much for your thoughtful example and topics. I would like to also hear from Dr. Tenshin and Niranjan. Suman Niranjan, like what motivated you, if you could elaborate a little bit? You're a computer scientist, and where and how you see the skill set would help others to make right decision.
Okay. So basically, like I mentioned, my background is in industrial engineering. So have been working on analytics, which predictive is one aspect of it, but I have also been working on prescriptive analytics, which uses simulation and optimization as the tools for prescriptive analytics. So here it's a very broad area. So my focus has always been on where there is data available. I can use some of my learnings and my experience in trying to analyze or apply the predictive or prescriptive algorithms to make better decisions, right? So I have been focused mostly on logistics and supply chain based research because of my background. But as I did mention to you all that I've had some interest in health disparity, went through some trainings as well as part of that, which caught my attention into this particular field. And I also realized the amount of potential that this particular field has to offer, especially when it relates to health outcomes. We are still probably in its infancy, I would say, in terms of what we have learned and how much we can perhaps accomplish in this, which probably brought me to this particular area in terms of trying to do more research and contribute in this particular domain. But also, like I said, I have always worked on interdisciplinary projects. It may be healthcare-based research or my other stream of research, which focuses on transportation psychology. So always worked with teams, and I believe that this particular area of research, which focuses on AI/ML with the application on healthcare outcomes, is truly an interdisciplinary research as well, and it requires not just folks who have knowledge of statistics and mathematics, but also computational analysis, and different levels of programming skills are also required in this. So everybody has a small place in this. I would say that probably one person knowing everything would perhaps be an overstatement. So all areas of expertise are necessary in order to make these important decisions. So anyways, coming back to your question, yeah, just the opportunity of being part of this wonderful group is how I ended up coming into the healthcare outcomes and AI/ML-based healthcare outcomes research.
Thank you. Dr. Shen, due to time, I mean, can you answer also as you talk about that question? Some of the question that was posted in the chat.
Sure, I can answer some of those questions. Can biases be built into the AI? Well, basically, AI is taking in a lot of data and then generate some sort of combining those data and evidence, give you some intelligent guess, prediction, and things like that. So if the data is biased, then AI is sort of bound to also provide biased results. And just like Usha mentioned, when the data is collected on only a subset of the population, just only Massachusetts, only New York, only California, then many of the findings we're going to get from the machine learning AI algorithms are based on these data and not including data on people in West Virginia, Ohio, other places. And therefore, for them, it's quite likely that there will be inaccuracy because data is not supporting the algorithm. And so indeed, this is an important issue that we are collaborating to examine the potential bias that could be fed into the AI and how do we measure it and reduce that. I hope that is helpful.
Yes, thank you. With that, would you like to add anything to this question that they have asked?
What there are more questions like software, right? What
Right,
software?
right. What software you use, pros and cons of using chosen systems?
Let me take that
Yeah.
question. Okay, I'll also stand up. I think it is fun, really.
Can speak louder. because
so-
the room is taken.
So the thing is, as the science changes from statistical computing to AI/ML, it's a problem of solving, creating solutions using huge amount of data, which are very diverse, which are coming very fast. So the technology has to handle it. Interestingly, unfortunately, the Python, along with other newer technologies that captures data automatically, for example, and new types of algorithms like what Dr. Usha was saying in terms of deep learning and other developments, we are able to now solve those problems, whatever we are talking about. Even though it could be more efficient as we go along, currently we are able to solve them. We are able to get solutions and use them on a regular basis. The simple training, from the training perspective, I would say we are going to use, for example, there are many possibilities, but the one I selected for you all is to use Google Colab as a training point, for the training purposes, because the reason is very simple. Python is central to it. Python programming language is central to it, and you shouldn't be spending a lot of time in setting up and making sure that all the packages are aligned properly and so on. That is taken care by Google Colab. So Google, with its might and its technology prowess, it is created as a platform which is easier to use. So in fact, in our course also, we won't put a lot of stress on you to actually work through a lot of details, because the Colab provides a lot of examples, case examples. So that's the kind of, I would say, basic technology that we'll be using it. In fact, the real world, industry people also use the same thing. So we are not going to give you anything less. I just want to assure you that.
Thank you. So when he's talking about you, he's looking at our current learners of our MSAOR program, and these are the courses he will be teaching. So he was emphasizing what technique he will be using in the course, and how and where this can be applied to other places. So thank you. That was so insightful. Anything else from our learners? Any questions? I think from online, Walter asked a question if this will impact the equity or disparity more. If we apply, go ahead.
I'll take it. As I
Yes.
said, it can erase disparities, but if it is not done well, it can create. For example, Dr. Chanshan was saying that if the data is biased, AI is not going to. It is AI algorithms in general greedy algorithms. They will try to maximize their performance. Okay, and if you don't handle, that's where you folks have to be brought on board, trained, and so on and so forth, so that we don't create AI algorithms which are biased, which can create more disparities, or actually it can probably create pain also because we don't apply correctly and we probably misallocate resources, misallocate the treatment procedure, and so on and so forth. So it is important to see. It is extremely powerful. The same extremely powerful stuff can become also problematic. So that's where the training also becomes important for everybody. So in short, yeah, definitely we have to be careful, so that it doesn't create more disparity. It can if it is not done properly.
Thank you so much. Dr. Shimon, would you like to add anything where and how you think this can be, or especially in your field?
As far as how we would apply this further?
Yes.
I think that as far as it goes, there's a lot of different programs. I know that we're talking about specialized medicine, but I think all of this goes towards with the combining of the information that is available. There's a lot more that you can look at to help, I think, with insurers, especially with my background, be more educated about their population and potentially what they might experience going forth, or what they might need to brace for with the different things that are coming down the line. And I think that health integration is one of the big buzzwords that's out there. And I think there's a lot of separation between just the medical side and the pharmacy side, and they don't necessarily see how everything is actually really interconnected, and even behavioral healthcare as well too. And so I think with all of these different areas that we look at, and if we can look again, like at all of the different sectors, that once we're able to know more, somebody had once said that all of the data will actually point to the disparity, and that will help us identify better what we need to focus on.
Yeah, I just wanted to say something about the prediction versus the
Share.
right, yeah. So basically, whenever people are talking about AML, everything is about prediction, right? I want to predict, right? Even when you go to Amazon, it's like trying to predict what you will buy, right? You don't know what it went into that, what explanation there is, right? So this is always an issue for any kind of, right, to predict or explain. Yeah. So to predict or explain is always an issue, right? So when you feed massive data into that, it's always like, how did you come to this decision? For example, optimal drug dosing. How did you come to this decision? What points I have to take care of so that, there is an optimal decision made. So this prediction and versus explanation is a major issue in there, right? So typically, how does an explainable AI look like? It looks like this, right? So you can see that, this is about 29,000 people. Every person is represented in that row. That first row where it is a median income, and you have the pink dots and the blue dots. The pink dot means higher income, blue dots mean lower income, same thing. Pink dots is higher poverty, blue dots are lower poverty, and so forth. And you can see that it's all over the place. It's not pointing to one direction. This particular project was looking at NSAIDs and incident cancer, right? And then remember, health is determined by so many factors. So you have to put all the social determinants of health and everything in there. And you can already see that, there are some that are like really a complex relationship, right? So even when the AIML gives you prediction, you want an explanation. How do I improve the health outcomes of people? So you need this explanation. And in terms of explanation also, we go into a personalized medicine. Look at these graphs. It's from a different paper. You can see that, for one person, like you can see the blues are driving towards, better mental health, and the red is driving towards worse mental health. You can see that for somebody like, age was going towards better mental health, but another person, age was actually driving towards poor mental health, right? So you cannot average it out. So when we talked about personalized medicine, this is how an explainable AA looks like. This is how a personalized AA looks like. So you can just pinpoint one person and say, I know that everybody is talking about like, income being, the main driver of poor health. Now I am going to look at this person who is poor, but still have a better health. Why is that happening? So that explanation is very important for us to achieve health equity or eliminate disparities. And I think this is what Dr. Samamurthy was also saying, that, if done right, you can do personalized medicine. If done right, you can try to eliminate the disparities in health equity.
Thank you so much. Our in-person learners have classes, so I will let them speak as we conclude. First, where and how you think you may utilize what you have learned here through our panelists, and also the courses that you have taken so far and what you will be taking pretty soon with Dr. Netra Sampamurthy and Usha Sampamurthy and other faculty.
Yes, I can go first. So for me, I think the biggest takeaway, and it's still kind of learning through as we go through these courses, but how can we use data and machine learning to help improve overall patient outcomes, whether that's at a local level, and directly, or, for possibly later at a more regional or state level, how can we use this data to help proceed and make real changes within the healthcare system?
And I would think for me, some of my biggest takeaways is from, I'm sorry, I can't pronounce your last name, Dr. Sampamurthy. Yeah. I would say a lot of it what I'm taking away is that being able to apply, like especially in my summer classic, I got a summer research project and everything like that. So in my head, I'm already kind of building networks and kind of trying to weave that into there to build like the best predictors for health outcomes. And like a lot of my natural like affinity is towards like formulation and wanting to get, in my head, better healthcare to patients faster. So I'm not necessarily creating any new treatment options or anything, but trying to get it to them faster. Because my thoughts was whenever I saw the health disparities CDC graph between rural and urban, one of the first thing I thought about is like distance, like they're distant from hospital, and think about like, say, if they have an ACS emergency, how can we get them on a helicopter quicker? Like what's some of the things we can try to implement to be able to help them out to bridge that gap shorter?
Patrick, would you like to add anything? And Walter?
Yes, and what I've noticed so far is that AI and machine learning is a skill that's really critical right now, particularly if you're involved in health economics and outcomes research work. It's increasingly being demanded in some of the positions I've seen. But coming from epidemiology, I see its role quite a bit in causal inference studies. So where big data sets are being used to make causal inferences outside the traditional randomized controlled trial framework. So in this particular, in the summer, I want to really get my feet wet with it. I have some very fussy ideas about what it is, but I hope I can, get to learn how to better manipulate it to answer some questions.
Thank you.
And I might just add that, as far as the equity is concerned, we should involve everybody in it because, as you have explained, it detects information and tries to use it to make predictions. And just like in trials, if we are not involving a diverse group in that primary data collection that we eventually feed into the system, then that's how the disparities will come in. So I think we should encourage people to, like you said, provide the data that eventually will be used to basically generate some of these decision tools.
Thank you so much. With that, I would like to let each of the panelists speak and then conclude this session. Dr. Shimon, would you like to start first? Any takeaway or?
I just know I actually signed up for a certificate too. I am looking at all of this and preparing for it. I mean, I know that there's so much that's involved. And it's interesting in my executive MBA class, it's mainly with physicians and other prescribers. And so we've actually had the talk about like the chat GBT and things like that with some of the doctors who are trying to, one of them, she is an anesthesiologist, and she was just curious to see what would happen if she used chat GBT to go in and try to write an appeal letter. And if funny enough, it said, you need a medical doctor to do this. So, but I think that there's going to be a lot of different ways that it's really going to enhance. Again, when we get all of that data together, it's really going to point towards the disparities. And I think it's going to make things, healthcare more available and ubiquitous out to other people, and can only better things.
Thank you so much.
Yeah, I liked the last student participant mentioned a solution to one of the questions raised in the chat. How do we make sure that, the AI will be equipped? Important thing is participate and give data. Everybody should contribute. If you want to be served well, your data should be there. Of course, there are some administrative issues and privacy issues. All those things, the system will take care of it, I trust. But every state, and Usha mentioned that only 3 states today participating, giving data. And that is really not the way. The way is everybody should be contributing. I think you made a very good point, excellent point. That was an answer to the chat question also. And the AIML will succeed, will provide the right answer to everybody, for everyone in the society equally, if you provide the data. Be participative.
Thank you for pointing out, though there is a quote that I believe in. What kind of tree are you? It is on your product, like a fruits, right? You don't have to say much. So in academia and as a professor, I take pride if my students or others, those who are learners, can answer or give us a solution. So that means we are doing something good somewhere. So thank you for pointing that out to us. And this program has these skills, has these tools that we can provide to our learners and help them learn this skill set. I want to also take a note that Walter Akbarbawa mentioned here. He's also one of our learners. He wanted to thank with the AIML and especially machine learning examples that you gave us, and they plan to learn from you more through our MSAOR program. I also want to thank others, those who participated online, and some of the questions we could not answer, email me, and also we will try to address as much as we can. Due to timing, we have to adjourn. Dr. Usha Sampamurthy, I will let you adjourn and finish our webinar.
Let me also hear from both Suman and Chan. What about the 30 seconds takeaway for students? 30 seconds takeaway.
All right, so very, very quick. I think AI ML has a lot more to offer, and it requires a lot of skills. So you have to be ready to be a lifelong learner. That's most important. And things keep changing all the time. And also the fact that I mean, just getting 1 degree, your learning doesn't get stopped right there. You have to continuously keep reading on several aspects. As I mentioned, it's an interdisciplinary field, which makes it more challenging. And all I would say is that continuously keep learning and take one step at a time. Don't get overwhelmed because it's an ocean.
Good advice.
Yeah.
Thank you.
Chan.
This is an exciting field with great potential, and I can hear the excitement and the passion from the students. I'm very encouraged by that. And just like Suma mentioned, the lifelong learning is going to be the norm for this generation of learners. And since we're talking about application of AI, ML in healthcare, learning about the domain, like the domain knowledge about health and how health data is structured, and confidentiality issues and all disparity issues, all these context of the application of AI ML is also very important. When you're learning about AI ML in healthcare, you sort of have to learn about the background of healthcare field, the whole healthcare outcomes field. So, and learning from multidisciplinary group and learn their language is very important as well.
I just want to add to both all the panelists that, it's a very complex. We cannot think AI/ML is a magic bullet. It's going to solve everything because it comes with its own biases, its own challenges, its own issues. So I think, as Suman Niranjan said, and as Chanshan said, lifelong learning, an interdisciplinary approach, and also an open mind and making sure that, we don't create biased algorithms, we don't create biased AI, and we don't exasperate the disparities and exasperate the equity. I think that has to be paramount in whatever we do. Thank you. Thank you.
Thank you, everybody. And I hope this webinar and this information session and hearing from our panelists enriched your knowledge and your passion, at least a little bit, towards this field. Thank you.
Thank you.